Anemia is when a person has fewer red blood cells than normal or less hemoglobin in the blood. Hemoglobin is the protein which carries oxygen in the blood. Anemia's result is a low oxygen level to the body and symptoms develop. The most common sign of anemia is fatigue and weakness because low oxygen means less energy to the tissues. The second most common sign is pale skin. It happens because reduced blood flow and lower levels of erythrocytes make skin, gums, and nail beds appear paler than usual. The third most common sign is shortness of breath. It means dyspnea, especially during exertion, for example, climbing stairs. The fourth most common sign is lightheadedness and dizziness or feeling that you might faint. This sensation is worse when standing up quickly. And the fifth common sign is a rapid, irregular heartbeat called palpitations. It happens because the heart works harder to pump the reduced amount of oxygen carrying blood around your body.
The most common cause of anemia is iron deficiency. Such anemia is called iron deficiency anemia. Iron is required to make hemoglobin, and without iron, red blood cells are smaller and more pale, called microcytic and hypochromic anemia. Iron deficiency anemia is responsible for 50% of all anemia. It develops commonly in women because of menstruation bleedings, in people who do not intake red meat products, and people with iron poor absorption. For example, people with Crohn's disease, celiac disease, or gastric surgery. Also, blood loss causes iron deficiency. For example, bleeding ulcers or colon polyps, they may develop unnoticed. So during pregnancy and childhood, demand on iron is increased and iron deficiency is common. The second most common cause of anemia is anemia due to chronic disease. It is called anemia of inflammation. That when a person has chronic inflammation, the body tries to hide iron from potential pathogens. So even if iron storage exists, it's not available for the red blood cells. The body produces erythropoietin, a hormone that stimulates red blood cell production. Red blood cells are typically normal in size and color, called normocytic, normochromic, but there are fewer of them.
Such diseases are infections like tuberculosis or human immunodeficiency virus, autoimmune diseases like rheumatoid arthritis and inflammatory bowel disease, kidney diseases or cancers. Such anemias are responsible for around 20% of cases of anemia. The third most common cause of anemia is vitamin B12 deficiency. This vitamin is required for red blood cell maturation and DNA synthesis. And when deficiency occurs, the cells are immature, abnormally large. That's why it is called macrocytic or megaloblastic anemia. These cells live a shorter lifespan and do not function properly. B12 deficiency develops when a person is vegan. Meat, poultry, fish, eggs, and dairy products are crucial. Sometimes the body mistakenly attacks the stomach cells, which are responsible for the production of intrinsic factor, a protein which is necessary for B12 absorption, and it causes a specific type of B12 anemia called pernicious anemia. Also, B12 deficiency is common in people with gastric bypass surgery, people with Crohn's disease and celiac disease, or when surgically removed small intestine. This type of anemia is more common in older adults, vegans, and strict vegetarians, and people with past surgery of the gastrointestinal system.
The fourth common anemia is folate deficiency anemia. Around 5% of anemia cases. Folate or folic acid is essential for red blood cell maturation and DNA synthesis. Similar to B12 deficiency, it also causes macrocytic, megaloblastic anemia. Folate is found in green vegetables, and people who do not intake it may be in deficiency, but rare. Also, people with celiac disease or Crohn's disease due to folate poor absorption. Pregnancy and rapid growth also requires more folate intake. And alcoholism, it interferes with folate absorption and increases folate excretion. Certain medications also, like methotrexate, can interfere with folate metabolism. Folate deficiency anemia is common in pregnant women because folate is crucial for fetal development, and deficiency can cause neural tube defects. And the fifth most common cause is hemolytic anemia. It's responsible for around 5% of all anemia cases. It happens when red blood cells are destroyed prematurely, faster than the bone marrow can replace them. For example, sickle cell anemia is a genetic mutation, causes abnormal hemoglobin and leading to misshapen red blood cells called sickle-shaped. They stuck in the blood vessels and are destroyed prematurely. Thalassemia, also genetic defect in hemoglobin production and leading to reduced hemoglobin and red blood cell destruction. Hereditary spherocytosis is a genetic defect in the red blood cell membrane, making the cells fragile and easily destroyed.
So this hemolytic anemia, many cases are genetical or acquired. For example, because of some medications, infections like malaria, or due to mechanical damage, for example, due to artificial heart valve. And now, let's say how to guess which anemia is presented based on blood tests. Primary initial tests are hemoglobin and hematocrit. Usually both of them are decreased during anemia. So hemoglobin and hematocrit are almost universal signs of anemia. They indicate that there is anemia, but doesn't specify which type of anemia. Mean corpuscular volume, or MCV, defines if anemia is microcytic, normocytic, or macrocytic anemia. So with MCV we define the nature of the anemia. Reticulocyte count is also measured. If high, it is common during hemolytic anemias. If low, more common during iron deficiency and vitamin deficiency anemias. It means not enough new red blood cells are produced. Immune deficiency anemia. Hemoglobin and hematocrit are low, MCV and MACH are low, which means cells are small and they have less hemoglobin. Serum iron level is low, high total iron binding capacity, and low ferritin, which indicates low iron stores.
Shame, anemia of chronic disease. Hemoglobin is low to normal, MCV is normal or slightly reduced, low serum iron, serum ferritin normal or high. This is the key differentiate from IDA. Inflammation causes the body to sequester iron, increasing ferritin levels. Ferritin level is considered one of the most specific for diagnosing anemia. Low ferritin almost always indicates iron deficiency, while normal to high characteristic for the inflammation anemia. During B12 anemia, hemoglobin is low, but MCV is high, and it is a key characteristic. Also, MACH is high. Also, serum vitamin B12 is low. This is the definitive test. Intrinsic factor antibodies are positive in pernicious anemia. During hemolytic anemia, reticulocytes are commonly high. Also, indirect bilirubin is high. It is a breakdown product of hemoglobin, elevated when red blood cells are destroyed. Now let's say about treatment of anemia, regimen of treatment, and effectiveness for each type of anemias. Now let's say about treatment. If anemia is caused by iron deficiency, iron supplements are prescribed. This is the first-line treatment. Common forms include ferrous sulfate, ferrous gluconate, and ferrous fumarate. Dosage varies depending on severity, but typically 150 to 100 mg of elemental iron per day for adults, divided into 2-3 doses. Taking iron with vitamin C as ascorbic acid enhances
absorption. Avoid taking it with calcium antacids or T-Hoffi, which inhibit absorption. They're usually taken daily for several months to replenish iron stores, increase intake of iron-rich foods, red meat, leafy greens, beans, and foods high in vitamin C to enhance iron absorption. Intravenous iron may be used if oral iron is not effective or tolerated. If anemia is caused by diseases, the disease treatment itself is considered core. In some cases, especially in chronic kidney disease, medications like erythropoietin can help stimulate red blood cell production. Sometimes given if iron deficiency coexists, though its benefit can be limited by the inflammation presence. In case of B12 deficiency anemia, B12 supplementation is considered treatment treatment, typically administered via intramuscular injections, especially if absorption is an issue, or high-dose oral supplements for folate deficiency increase consumption of folate-rich foods like leafy green vegetables, legumes, and fortified cereals, or daily oral folic acid supplements. For hemolytic anemia, specific treatments are required depending on the cause.